good?
Yep.
The saddest day of my life was the day John Hinckley missed Reagan.
Did he just get high, or does he have a central nervous system infection?
This doctor had a mask, goggles, hairnet. I mean, he looked like a cartoon character.
He would come into the clinic and just start screaming at us.
We would get these patients, and every one of them would die. You like to give them something to make them better, and these patients didn't get better. It was a little frustrating.
I'm not good at disassociating, just going there and doing it and leave. I'm sort of pretty attached to my patients, sort of wear my heart on my sleeve type thing, so I always found it very exhausting.
RID, gay-related immune deficiency.
Wrath of God.
Plague, acquired immune deficiency syndrome, AIDS.
As Professor Seaman introduced, my thesis is entitled Fighting a Plague, Doctors' Stories of Challenge and Innovation Combating the AIDS Epidemic in New York City in the 1980s. This thesis is very personal to me on multiple angles, and has truly been a rewarding project of self-discovery. Now, as a gay-identified man attempting to enter into the medical profession, I find myself torn. A rough history has existed between the queer and medical communities, and still persists today, with many gay physicians opting not to be out at work. I, myself, have been advised not to place my work with the gay community on my med school application because of the conservative nature of medicine. At the same time, gay community members remain vigilant in critiquing Western medicine, which has viewed homosexual behavior as a pathology until the 1970s through queer theory and activism. As we begin to look back at the early AIDS epidemic, it has become increasingly important to monitor how the early epidemic is portrayed. The overall narrative of the early AIDS epidemic is constantly shifting with the rapid influx of scholarly work and mainstream media. This work has revealed a hole in the AIDS narrative. While the politics and the science of the epidemic is widely reported on, the narratives of the physicians, those who saw the epidemic play out in front of their eyes, has been absent. Such absence in turn has become clear in recent media portrayals of physicians in the epidemic, which have either demonized or sanctified the physicians who looked after AIDS patients. My research question asks, how did physicians working in New York City respond to the beginning of the AIDS epidemic in the 1980s, and how has this affected modern American medicine? To answer this question, I have turned to theory, epidemiology, history, biology, and primary research in the form of 8 in-depth personal interviews of physicians who worked in New York City during the AIDS epidemic. Their specialties range from neurology and nephrology to critical care and ophthalmology. Their ages, hometowns, sexual orientations, genders, and political stances vary, which provided multiple perspectives towards the early AIDS epidemic in New York. In this thesis, I argue that HIV/AIDS provided unique biomedical, social, and political challenges to the physicians working in the city of New York during the 1980s in ways that no other epidemic has. The physicians adapted to meet these challenges using methods that have become commonplace in American medicine to this day. To bring the words of the physicians to life today, to remind us of the humanity and the reality of these quotations, I have asked a few of the cast members of Dear Harvey, Marlene Cox, Taylor Rasmussen, and Andrew Walker to assist with this presentation. First, we will discuss the biomedical challenges that the physicians faced during the epidemic. It is interesting to note that prior to AIDS, the medical community thought epidemics were a thing of the past.
Remember, there wasn't anything like this in anybody's experience because all of the big epidemics like polio, measles, and all of this stuff were behind us. Tuberculosis was gone. There were decades and decades of hell.
I will never forget the chairman of medicine at Lenox Hill said to me after I finished my residency. They wanted me to come and run the AIDS unit at Lenox Hill Hospital. The chairman of medicine said, I think you're going to really regret it at some point because AIDS is really popular right now and a goldmine for getting funding, and everybody else is getting cheated out of their funding. So it's not going to be the focus forever. You've got to decide if you're going to go with it and run that risk, or expand and get a broader skill set.
AIDS wants the medical community to monitor epidemics more closely. At first, AIDS patients confuse physicians because they're few in number and the opportunistic infections that they are dying from were extremely rare and typically did not manifest in young people.
There weren't a lot of people. There were just a couple. The first report was in 1980 with just 7 patients. It was a really rare disease at that point. We didn't know there were opportunistic infections. They had diarrhea that we couldn't diagnose. Then they had pneumonia that we couldn't diagnose. Then they had skin lesions, and that turned out to be Kaposi's sarcoma that was so rare that people couldn't believe it, or the diagnosis wasn't correct.
To handle the issues of diagnosis, physicians worked to create a more streamlined reporting system to the Center for Disease Control, the major government epidemiological center in the United States.
I think our ability to report has improved substantially. I think that people now know if you see something odd in medicine, you report it. There is more understanding of what is reportable and what's not.
One issue was that of nomenclature for the new illness.
It was called a bunch of things. One guy said he heard it called Wrath of God.
It was definitely not hospital-wide. I think it was just a few people in the doctor's lounge sort of making snide remarks type of thing, but I definitely heard it more than once. I don't think it was the prevalent thought process.
GRID was much later, like 1982 or 3. Gay-related immune deficiency.
I didn't find GRID offensive. It was a descriptor. There was just so much confusion about it at first. It wasn't entirely clear that it was a viral infection initially.
The risk of contracting the illness was unknown, which offered many challenges.
The restaurants in Greenwich Village were all closing. Nobody wanted to go to the village to have dinner. There were all kinds of ridiculous concepts and fears that were all based on the fact that nobody knew what it was.
When my daughter was being born, there was this big rumor going around that if a mosquito was going around that had just bit a person with HIV and bit you, it could transmit.
Physicians weren't applying to work in New York, and some refused to care for AIDS patients.
There were some people that were so concerned they wouldn't even go into the patient's rooms.
Physicians responded by reframing the epidemic to physicians and the development of universal precautions.
AIDS gave us a blueprint for universal precautions. The whole idea in healthcare is that you don't just ask about the disease if you're gay or use injection drugs, but you should treat everyone as if they potentially have it, that all blood is potentially hazardous and those sorts of things.
We had a new chairman of medicine that we knew kind of turned around the concept of having all these HIV patients by publicizing the fact that we had a very special disease here. He twisted the situation to make it more favorable to have people who were interested in infectious disease, that patient population, or the concept of finding with a brand new disease and working with those patients.
AIDS also presented a great deal of social challenges for the physicians working in New York City in the 1980s. This is largely due to the types of groups that contracted the disease and the stigma associated with the disease. This epidemic, unlike others previously, did not impact all of society equally. Transmission was due to behavior, and it hit groups already marginalized by American society, in a point in history where there was a resurgence of conservatism embodied in the moral majority and Reagan-era politics. Gay men and injection drug users were the first groups to get the disease in the early 1980s. Each group had different relationships with the medical community at large, the politicians that drafted policy, and most directly, the doctors that were treating them. AIDS alone was heavily stigmatized.
There was quite a scare. When I tried to move to Pittsburgh in 1988, they tried not to hire me unless I got an AIDS test. I fought it. I said, that's illegal. I fought it all the way to the top and actually got the university to change their policy.
The AIDS cloak was rolled out and people spat on it. It was filthy to them. I didn't understand it. I was horrified.
I think there were people then, and there are people now, who thought that HIV was a punishment for something. I mean, it never made sense to me. That's not the way science and infectious disease works.
With AIDS patients, physicians had to learn to ask sensitive questions.
I mean, with the injection drug users, you had two diseases already. You had the viral infection, and then you were dealing with addiction that was difficult to break. We were not able to treat the addiction. I remember one specific time when a patient was not in his room, was found dealing or buying drugs in the public area down the hall.
Say I go in, and I find a patient who's acting a little strange, whose mental status is a little off, and I'm trying to decide, did he just get high, or does he have a central nervous system infection? So I asked him, did you just shoot up? And he said, yeah.
A lot of them hadn't told their parents that they were gay, let alone sick. It made it tough. Normally it wouldn't be an issue. I mean, I was not telling families that their children were gay for years. That wasn't the issue. The problem was that now their sons were dying, and families wanted to know why their sons were dying.
With patients with special medical needs, physicians began to take a more collaborative role with the patients, rather than just dictating the treatment.
I think it forced the medical community to have to work with a higher proportion of patients who were really smart about their condition. It forced the medical community in particular to act more in a partnership than in a kind of dictatorial frame of mind. I think that was a good thing for medicine.
I think many more doctors became more open to the idea that American medicine didn't have the market cornered on providing aid and comfort. I think it really helped understand the prospects for a more holistic approach to medicine. By holistic, I mean taking care of the whole person, the spiritual part, the emotional part, not just the physical.
AIDS was also largely a political topic because of its lethal nature and the marginalized groups it affected early on. The professionals adapted to the political criticism and changes in health policy. Some physicians fought for more compassionate policies for AIDS patients in hospitals.
I had a chief resident who I got in a lot of trouble because he was a dweeb. One night we went into the room of a patient being admitted with AIDS, and at that point, we knew you didn't need to dress up like a man going into outer space. This doctor had a mask, goggles, hairnet. I mean, he looked like a cartoon character.
We thought it was immoral to wear gloves and masks and gowns because people were dying. They needed humanity and not sterility.
The hospital actually made a policy that you couldn't refuse to care for patients. You'd be fired for doing so.
National policy at the time was lacking, which led to a polarization of AIDS politics. Just 3 days after the historic AIDS bill laid on the National Mall, Amendment number 956, which would become known as the Helms Amendment after Senator Jesse Helms of North Carolina, began with the following statement of purpose.
To prohibit the use of any funds provided under this Act to the Centers for Disease Control from being used to provide AIDS education, information, or prevention materials and activities that promote, encourage, or condone homosexual sexual activities or the intravenous use of illegal drugs.
Mayor Ed Koch of New York City and President Ronald Reagan neglected AIDS policy. Reagan did not mention the word AIDS publicly until 1987, 6 years into the epidemic. Physicians were left with few resources to combat the epidemic, and the debate over AIDS policy was brought into the hospital.
I hated Reagan, of course. I was really angry. I think he could have said the word, for starters. He could have made it more a priority to protect people who at that point were not infected. I think who suffered most were particularly IV drug users, women, and children. They had the lowest level of awareness of their potential risk, and children didn't have a prayer. Women who were pregnant and had HIV weren't even aware of the risk for the baby. I think not having the funding to educate people and to screen and test sex partners at risk is criminal. I felt that all along.
Physicians reached out to the groups that the health policy neglected, creating clinics and working within communities to aid people who could not access health.
We would prescribe condoms, which was against the rules of the church. St. Vincent's Hospital did not approve of us doing that, but we did.
Some faced while others became part of AIDS activism. Organizations such as ACT UP, the AIDS Coalition to Unleash Power, would stage kiss-ins and die-ins in hospitals, churches, and government agencies to raise public attention for AIDS.
ACT UP was just so angry at anybody who was working within any kind of infrastructure. They would come into the clinic and just start screaming at us because we were part of the federal health system, saying, "Don't you know Reagan is trying to kill everybody?"
In this point in history, the year 2014, America is in the 33rd year of the AIDS epidemic. Now, the epidemic has spread across the nation to all races and socioeconomic levels, and antiretroviral therapy has extended the life expectancy of HIV-positive patients to be essentially equal to those who are HIV negative. For the physicians who worked during the 1980s in New York City, looking back at the AIDS epidemic was not easy. Even though the early period of the epidemic was over 2 decades in the past, all the physicians still had vivid memories of patients and coworkers, as well as their own thoughts of uncertainty, fear, and sadness. The compilation of the physician stories in the study, though they differ in many ways, has revealed a common narrative of physicians who worked in medicine in New York City in the 1980s. This study has shown that while the medical field certainly was not perfect, the overall narrative was one of struggle, adaptation, and ingenuity in spite of unique biomedical, social, and political challenges distinct to AIDS. The physicians, over the course of the 1980s, adapted to meet these challenges using methods that have become commonplace in American medicine to this day. And now at this point, I'd like to thank all those who made this life-changing sleep possible. The 8 physicians I interviewed, Kolva, Professor Seaman, my fabulous advisor, Shiva Sparman, my TA, Kara Dickinson, Professor Susan Linsky from the Theater Department, Professor Robert McCrew and D. Gilson from the George Washington University, Professor Ramsey Fawaz from the University of Madison, Wisconsin, the cast of Dear Harvey, and thank you.
little bit more about your research in terms of how doctors felt about ACT UP, because you made a great point, like how does surviving plague and a lot of kind of cultural representations now really demonize doctors or show ACT UP demonizing doctors, and you kind of talked about the relationship as well, but if you could just speak more.
Most of them loved it. They're actually like super like happy about it because there wasn't any work being done from the policy level. So they're just like happy that people were actually doing something about paying attention for it. And actually like he was part of it. So and he dated Larry Kramer who founded ACT UP. So it was generally really positive towards it. Although like yeah.
This is great, really interesting. I'm curious, are you the first person to sort of dig in and do this type of qualitative research and talk to folks and document this? Who else is having this conversation?
When I was doing like my background research like months and months ago, I found one dissertation from University of Pennsylvania who did the same thing but just talking about nurses. And I was trying to like initially when I was beginning this process, I was trying to do doctors, nurses, and even like physicians' assistants and such, but it was very hard to track them down because it was 3 years ago. So like really there hasn't been a lot that I was talking about. It's really been pretty silent. I don't know. I guess, I mean, from my experience, getting these people to sit down and interview was the worst thing ever. I had 3 interviews with him, 2 with him, 4 for her, and like 2 of them were my parents. Like, and the doctors are super busy, and especially at that time during the epidemic, they're way too busy to even like processing it. Like, most of the people I was talking to, like, I mean, Craig, like, his brother died, and like, he was saying like, out of his 30 best friends, only 2 survived the epidemic. He, when I was talking to him, he just paused in the middle of the interview and literally said, I've never thought this through, because it was just so much at once, and it's just like, they want me to get beyond it. Yeah. So again, it was like working in a very specific location in a very specific time period. So recruitment definitely was not blind. That would have been ideal for like a little study. But I tried to be as diverse as possible. Definitely with specialties, like a lot of the doctors like would come up to me, or like when I asked them, I try to recruit them, and they would basically say, oh, like I'm an ophthalmologist, that has nothing to do with AIDS. And then I'd talk to them and they'd have these like profound stories because literally everyone has a deal with it in one way or another. So like there's only one person who's actually like specifically an AIDS physician, and the rest of them were doing all sorts of different things. But recruitment was based on, and I didn't really mention it because it's like, I guess it's a key part, but both my parents worked in the AIDS epidemic. So that's like when I really got really interested in this topic. And, a couple of them were recruited through their coworkers and also people that they knew were very, very active during the epidemic. But other people, like, I made like a Facebook post, it's like, does anybody know someone who worked in the AIDS epidemic? I got a couple people from that. There's like a lot of friends, relatives, and stuff like that. It's really old.
It seemed from the quotes you guys gave that a lot of the doctors were pretty combative in terms of fighting, a lot of the prejudice of the disease and things like that. But obviously in the 1980s, I'm sure they still didn't know a lot about it. And I was wondering if you felt that any of them had any regret with the way they approached AIDS patients in the early years.
Yeah, I didn't really come across that now.
It was just they just went along with their understanding.
Because a lot of them like didn't like really feel guilt because it was just like they didn't feel like they did anything wrong because they knew nothing.
Right.
So it was like, a lot of the time like they were treating like the opportunistic infections, which is like what the disease actually manifested in, and that they like did that, and it was like very standard to treat those. But usually when you treat these simple illnesses, they get better. So they were doing what they thought was right, but they just didn't know.
Sure.
But I think like if you look at like a lot of like writing from like Peter, like there are a lot of people that like said some very horrible things and were very upfront about it. But yeah, all these physicians, like again, it's a very specific group of people who I was interviewing. They're from New York. very cosmopolitan. They've seen all walks of life. So it was a very specific group. I imagine if I had interviewed a bunch of people in like say like Middle America, it would have been a totally, or even like a couple miles outside of New York, it would have been